All right. Please take your seats. All right. It is my pleasure to welcome here Pavel Yakovlev, who is the Director of the Computational Biology Department at BIOCAD. So it is our pleasure. Please.
Thank you. So, hello everyone. I am Pavel from Computational Biology Department of BIOCAD, and some of you may know me as a protein designer, and that is right. My main area of interest is biological therapeutics research, where I and my team are creating some novel methods and tools for rational antibody engineering. And yesterday I've heard some conversations about antibody humanization in a lobby. So if you have some questions about that or just want to talk about it, feel free to find me today. It will be my pleasure. But today I'm gonna talk about some mathematical tricks on small molecule heat generation, not about biologics. And to get you into the context rapidly, let me briefly introduce what BIOCAD is today. So BIOCAD is an international full-cycle biotechnology company with 7 branches worldwide, and our main areas are oncology and autoimmune diseases, and we are the #1 company at these areas at our homeland. We have 46 products on the market already and more than 60 projects in our pipeline on different stages of development and clinical trials, and most of these projects are multi-specific antibodies, so we have binders to almost all immune checkpoints and most of oncology targets. Most of these molecules are created using some bioinformatics and computational biology approaches that we also use to speed up and support all of our R&D processes, but it wasn't always so. BIOCAD is a very young company, so while most of oncology market players were founded centuries ago, BIOCAD was started just in 2001, 4 years after rituximab, the first anti-cancer monoclonal antibody, was launched. So we didn't have both experience and expertise of all of these great companies. That is why we were able to start our first monoclonal antibody project just in 2012, and by this time there were several dozens of antibodies on the market already, and the immune checkpoint revolution has already begun. But what did we have in 2012? It was a couple of very unhappy llamas on the north of St. Petersburg and a female camel in a near Moscow forest that we use for immunization, a high-throughput phage display technology, and an old 454 sequencer that raised AUPs even when buying. We wanted to use all of this stuff to create a classical antibody research pipeline, immunize animals, find some leads, characterize them, and then produce. To increase our speed, we decided to use lots of automated machines for every research and development step of our process. So our labs look like more production halls with all of these robots. We really thought that this will speed up us a lot, but we were wrong, because all of our researchers were buried by piles of data they couldn't deal with. And this was a nice impulse to start a data analysis division at BIOCAD that was firstly specialized on data processing like NGS analysis or protein characterization, but then was converted to a computational biology department with 3 internal branches: bioinformatics software development, data analysis, and structural biology. This helped us to solve our productivity issues and became the company with all the products we have now. And maybe that is why we were brave enough to start our original and novel small molecules branch in 2014. By this time, we didn't have a huge chemical library, no parallel synthesis of thousands of compounds, and as you may know, there are some troubles with chemical reagents delivery into Russia since 2014. But no matter what, we started with a couple of HCV projects and then moved to our primary area, oncology. Here we have a number of next-in-class projects with well-characterized targets where we are trying to find some novel compounds, and of course we have a couple of high experimental first-in-class projects too. We started to use in silico tools a lot, both house-made and external, to select some molecules that should be synthesized and characterized in vitro. But here we faced some problems that all the molecules we are characterizing should be drawn by some medical chemist or should be found in some huge random library. But as I told you before, our synthesis is slow and we do not have any medical chemist at BIOCAD. So we faced a real problem: where can we find some novel molecules to screen and how to optimize the hits we got. To get started, we decided to generate some combinatorial libraries from little fragments. So these fragments were selected by some pharmacophore or docking screening and then attached to each other. To make it possible, we downloaded and annotated millions of compounds from different vendors and aggregators. But our first test showed us that the size of our libraries grows exponential by the number of generation, while just a little subset of the molecules in our libraries are unique. To solve this problem, we designed and implemented an algorithm for graph automorphism detection. We represent each molecule like a planar graph and then search for its symmetries to detect the unique points where we can attach new fragments to. This approach helped us to reduce the needless work on molecule clusterization or duplicate molecules in silico characterization, but not all of these molecules could be synthesized, and this is the next problem. We decided to modify our algorithm and add some reaction rules to it. The rules of building block linkage. As planar graph isomorphism is a well-known and solved problem, we can search some structural patterns in our compounds by structural search, and the patterns themselves could be represented just like smart strings, because it's easy to generate these strings and easy to store them. So for each type of reaction our chemist can do, we created a number of rules to use with our generator, but we don't think that this approach is nice, because we have more than 1,000 rules for each type of the reaction, but it is a suitable temporary solution. The other way is to use a bottom-up approach and synthesize these rules from some basics physics, so quantum mechanics and resonance theory can help us with that. These methods can predict us some suitable parameters of our molecule depending on some environment and conditions, and these quantum mechanics based parameters could be useful to separate molecules that could be synthesized by some reaction from the molecules that cannot. If we obtain a big data set with known synthesizability, we can construct a machine learning algorithm that will separate these molecules and generate us some simple rules that would be physics-based and not knowledge-based, and this is the approach we are using in our generator now. So for now, we can generate novel and synthesizable molecules from the best scored block and do it fast. So we have millions of them. So it takes a while to prepare them by conformational search, predict some ADME doc, and maybe use some free energy estimation methods. But after all of this work, we got some best molecules with a suitable parameters, and if we synthesize them, we can find that they have some detectable in vitro activity. Unfortunately, their properties are not good enough to go with these molecules to clinical or even preclinical studies, so we have to optimize them, and we still do not have any medical chemist, so how can we do it? In silico and in vitro analysis helps us to score this molecule by some complex functional that considers both activity and ADMET. So we wanted to find some best molecules and generate something nearby that will maybe have some more suitable properties. To perform it, we select the best molecules we have to some corpus and train a recurrent neural network to generate some molecules that looks like the molecules in the corpus, but they're different from them. We also add some random compounds to our corpus with unknown properties to increase some diversity of our molecules. This helps us to find some novel molecules, and if we are lucky enough, these molecules even have some better properties than the best molecules that we found by our random screening. This helps us to do some local optimization like any medical chemist do it. But what if the best molecules lay in some other chemical space, not in the place where we have searched by our random library screening? Our local optimization cannot perform such a huge step, so we will never find these best molecules by this method. And the question is, can we do better, and can we find these molecules? Medical chemists will tell you that you should work with some chemotypes and search something nearby the molecules you have. But as I'm standing here, I think that yes, we can do better, and some simple math theory can help us to get better optimization of our molecules. So, by this step, we already have some points, the molecules that are characterized in silico or in vitro, and this means that we can create some model that will predict the properties of these molecules. Of course, this model will have zero error on the points we already have, because this is our training set, while the error on all other chemical space could be huge enough. Despite this, we can find the point where our model shows the least value. Let us suppose that the least value of our model is the best point for us, and it is optimum for all of our properties, both kinetics, thermodynamics, and ADMET. And so this point of our model maybe show us some best molecule, but this is just a single model, and of course this optimum cannot be real. So let us add a couple of more models, and what we have now is some probability distribution of minimum location of our chemical space. We can continue to add new models, and the more model we add, by the number of models, the probability distribution will change too. But from some number of models, this process will start to converge, and we will have some probability distributions that wouldn't change anymore. And that is what we are looking for. So let us suppose that for now we have constructed an infinity number of models, and that means that we have some confidence intervals of our functional values for each point of our chemical space, and these confident intervals are huge enough in unknown places of our chemical space, but they are just point at the molecules we already characterized. And also we have some continuous distribution of posterior probability of the minimum location of our functional. So let us look to the least value of our functional. It would be the highest probability of our distribution. And again, if we will be lucky enough, we will get some molecule that is better than our current leader. But what we have now, using this point, we can retrain our models and have a new probability distribution with a shifted peak. So we can choose the next point and look at it and characterize it by in silico or in vitro assays. And as more point we have, as sooner we will come to some optimum. And these steps can be large enough because we do not optimize the molecules we already have, but we recompute all the probability distribution on each step of our process. So we can go far enough from our initial leader, and probability theory tells us that this process will converge to some minimum, maybe not the global one, but at least a fairly deep local. This method is called Bayesian optimization, and it was introduced in 1978, but got the second breeze at the end of 2000s on the problems of neural networks metaparameters optimization, where you cannot just perform a grid search in the old search space, while the random selection of these parameters gives you some suboptimal solution. So as Bayesian optimization use functionals, we can optimize both thermodynamics and ADMET at the same time. We need some homogeneous function set, and there is a good one called a Gaussian process that we can use for our models. The method requires a compact set. We will face this problem a little bit later, but for us it means that we should use some finite chemical space. It may be huge enough, but not the all chemical space. And at last, our algorithm arguments should be represented as n-dimensional real vectors, and this is a real problem, because our molecules are not real vectors, they are graphs. And here we face the next problem: how can we transform our molecular graphs to some n-dimensional real space vectors and back? So we use neural network autoencoder to train a model that repeats the smile string that we have on the input of our model, and gives us the same smile string as the result. And in the center of this model we have some vector that represents our molecular graph, and as we have an autoencoder, our smiles representation can be fully encoded to this internal vector, and this vector and the molecule could be restored by this vector without any additional information. But of course we can have lots of different representations of this vector, but we want to use the best one for our needs. So we train one more neural network on this vector to predict some useful parameters like ADMET or pharmacophores or docking score to some targets, and this helps us to select the best vector that represents the chemical properties of our molecules. So for now we obtain an n-dimensional real space vector from our molecule, and we can use this vector for our Bayesian optimization. This vector representation have a very great and necessary feature that by changing of some of its components we will have some novel molecules, and if we take a couple of points in n-dimensional real space, then all the points on the segment between them will represent some molecules too, and that is what we really need for our process. But of course, as you can expect, Bayesian optimization is not a panacea, and there are a number of problems, both method-based and domain-based. And first problem is from our graph vector isomorphism. Let us think a bit. We have much more n-dimensional real space vectors than the molecular graphs. So not every point in n-dimensional space represents some molecular. So we have to implement some tricks to find the moleculars nearby, and it's really painful. Of course, if you use some machine learning techniques, you have to represent your molecular graph to your models, and we have chosen a smiles representation, but it has its problems too. Again, it's much more strings that represent some molecular graphs. So when you use smiles in your generator, you will always have lots of invalid strings that do not represent any molecules, and you have to deal with it too. And the last problem is method-based, because Bayesian optimization as a mathematical method has lots of own metaparameters, and it is very sensitive to these metaparameters. So you have to optimize them to get the better result. Okay, so some things to take home from this talk. First of all, of course, it's better to have medical candidates than not to have, but if you do not have one, use math a lot, because there are lots of great mathematical methods from some adjacent areas that you can use in drug discovery. And of course, when you use some machine learning techniques, you need and work with small molecules, you always need some molecule vector isomorphism, and it is a real problem, and maybe we should solve it all together, because when we find some suitable solution, we can increase the quality of all the small molecule research area. And of course, we live in a data-driven world, and the processes we are looking at are too complex, so we have to use some machine learning techniques, and data accumulation and description became much more important than ever before. So please collect the data, because it can help us and other pharmaceuticals to create novel treatments. At last, I would like to thank the great team of computational biology department who did all the work I presented today. Of course, it couldn't be possible without our biologists and chemists who do all the real work while we are just sitting in front of our computers. And I would like to thank all of you for your attention, and I will be happy to answer your question now or during the dinner. Thank you.
Thank you, Pavel. Questions?
Yes, thank you for the very interesting talk. I'm just wondering, so you say about representation of chemical molecules as some vectors, so
Yep.
This is what you base your theory on, but how do you deal with the flexibility of molecules in the real life? I mean, if you put the molecule into water solution, it's not just a rigid structure. It's flexible, so that's when
Yep.
you will have it.
So we represent the molecule formula, not its structure, because we think that when we work in some similar conditions. So the same molecule molecule will have the same structure, so we don't represent the structures like vectors. We the three-dimensional structures. We represent just two-dimensional molecules. But this is some other problem like polarization in some conditions, and of course we need to represent differently polarized molecules like some similar vectors, not the exact similar but the near one, and we do it using our second neural network that predict us some ADMET characteristics, and one of these characteristics is the polarization of our molecule and how it would look like in different pH levels and something like that.
Yes, thank you. But just in the continuation of that, how do you feel? So with the things you know that you miss in your models,
yep.
How far do you think you are at the moment from just random choosing the molecules?
Yep, it's a great question because it's a common problem because you are implementing some complex solution, and then you are trying to compare it with just with random selection, and then you found that random selection is even better than your complex algorithm. Yeah. So we started with some random libraries, and we just created some libraries from random fragments. So we have some material to compare with, and for now our libraries are much less. So we started with 7 million compounds library, and now we work with libraries of 100,000 or 200,000, but the quality of the results are the same. So you can significantly reduce your chemical space and significantly reduce all the work you need to do on characterization without any loss of quality.
Okay, thank you. I will let some other people to ask the questions.
Thank you, Pavel. I just wanted to continue a bit on this very interesting issue. So, if I understood correctly, you use only the parameters of your graph, namely, well, the length of the distance between the atoms, the type of atoms, and
the type of bonds.
Type of bonds between them, and based on that, you select in a continuous space some point that might not have any real structure. And then, do you use the same approach to predict like the other parameters like ADMET?
Yeah. So when we train our model, we are trying to use some vector representation that will have some physical meaning. So this vector representation could be suitable for some ADMET parameter prediction, and that is the key idea of our autoencoder. But the real problem is that n-dimensional vector space is continuous, while graphs are not continuous, and so we have lots of holes, and our space is sparse. So we have to deal with it, and this is a key problem of this solution.
Did you think about evolutionary algorithm in your model?
So you can look at Bayesian optimization like on some evolutional model, because you recompute some probability model using the molecules you already characterized. So you do not generate novel molecules, but you just get them from some chemical space, but the method you do it is very similar to any evolutional methods. But I think 2 years ago we tried some genetics algorithms on compounds research, but the key problem is that you cannot control the synthesability of these molecules. So when you work with some reduced chemical space that contains only the molecules your chemists can synthesize, it's much more possible that you will have some success on your small molecules research.
I have a question from our IT group.
You mentioned very high error rate when you are generating molecules. So can you comment in more details about type of errors which you meet? So how many of them are invalid bonds? How many of them invalid, let's say? And by the way, do you include stereochemistry modifiers in your smiles because smiles are low?
Yep, we use.
So which are types of these errors?
So who is familiar with smiles in this? Okay, it's better than I thought. So smiles representation is a simple string representation. You can go through your molecule using deep first search algorithm. And how many of you are familiar with DFS algorithm? I think these people are the same. Okay, so you can go through your molecule and just write all the atoms and the bonds you saw during your work, and this would be a smiles representation of your molecule. So it is some grammatics, it's string grammatics, how you can describe your molecule. And the first problem that these grammatics is very strong, but if you have just a single error in your string, it wouldn't represent any molecule, and this is the first problem. The main problem for us was unclosed brackets. Yep, of course, because any recurrent neural network forgets about brackets, because it cannot look so deep to our molecule, and if our molecule have, I think, 100 atoms and some branches inside, the brackets wouldn't be closed. The other problem is valence of our atoms, because models sometimes gives you some carbon with 5 bonds or something like that, but the main problem are brackets.
There is more. But brackets means the cycles.
Yeah,
so it means
not the cycles, but the branches.
Oh yeah, the branches. So it means that today your neural network cannot. Okay, it cannot create.
It can.
Just
but your
30%. It's very low rate. No.
Yep. But it can do some brackets, so some branches, but these branches shouldn't be very deep. But if your branch contains some 10 to 20 heavy atoms, everything will be okay. But when you work with some protein-protein interaction inhibitors that contains 200 atoms or 300 atoms, it can be very complex for this model. And this is a common problem because there are lots of research from Google on smiles strings representation, and the error rate is something like 90%. So you have only 10% of correct molecules when you use classical char-RNN or some models like that.
There are further questions?
Hello. I have a quite obvious question concerning architecture in your RNN encoder decoder. Do you have some baseline in your solution which you can compare with?
Yep.
And
so we have some Google models that have very nice papers, and we we were happy to find these papers, and we took them. We took the architectures from these papers, and then we understood that these models can represent only the molecules that are described in paper, and one step to any site, and it will not work. But this was our baseline, and we couldn't use that neural networks, so we had to create our own architecture for it.
Okay, and by RNN in your slides, you mean vanilla RNN or with gates units like LSTM, or it's just simple RNN?
So it's LSTM based RNN.
Okay,
but
that's nice.
If you have some additional questions about architecture, you can find me during the lunch, and
that would be nice.
Talk about it.
Thank you.
All right. Well, with that, let's thank Pavel again.
Okay.
Now it is lunch break, and we'll be back here at 2:30.
Hello guys on Twitch, YouTube, package. Good game. Thank you for watching us. So now we had a lecture from Pavel Yakovlev from BIOCAD biopharmaceutical company. It's a Russian-based biopharmaceutical company, the leading one, I'd say, in Russia. And so the lecture was very nice about application of different computational approaches like neural networks and Bayesian interference methods into design of new small molecules which are to be the drugs, for example, let's say cancer or any other important diseases. So thank you for watching us. The next stream we will have, let me check. So the next stream will be tomorrow, and we will have, okay, we will have 2 streams tomorrow. In fact, we will have a lecture from Mikhail Pyson. He is a CTO of Yandex Health. It's a daughter project of Russian IT giant Yandex. It's a it's like a Google just in Russia. And this service, Yandex Health, is dedicated to telemedicine, to application IT into analysis of basic clinical data, data from wearable devices, and so on. And the next lecture would be presented by Alexander Panchin, and he is a very popular, in Russian at least, speaker about so he specializes in popular science, but also he is a PhD in biology, in evolutionary biology, and he is a scientist at Institute of Information Translation. Sorry, I do not remember. In fact, so he is a member of one of the Russian institutes of Russian Academy of Science, which specializes on the information, on coding of information. But he will present his popular scientific lecture, Time Traveling Porn and Other Signs of Reproducibility, Apocalypse. And I think it will be very great. So not to miss our stream, please subscribe to our channel on every platform. You see us now, you watch us now, like YouTube, Good Game, Twitch, and of course Pekach. So it would be nice to meet you tomorrow at our lectures. And I want to remind you that all the lectures from our school, or almost all the lectures from our winter school, will be deposited on our YouTube channel, also called Future Biotech, and you will be able to watch them later. And also we already have many lectures, many recordings from lectures of top world scientists, including Nobel Prize winners, on our channel. So please feel free to watch, to comment, and we will get back to you and comment, to reply something. Okay, thank you for watching us. This was a translation by Future Biotech Live, and my name is Arthur Zalewski. I'm a director of Future Biotech Live and also a PhD student and Lomonosov Moscow State University at Faculty of Bioengineering and Bioinformatics. And this translation was from Future Biotech Winter Retreat 2018, and these let's say kind of a conference or maybe winter school is dedicated to application of IT in biology and medicine. And all the guys you were able to see here in the hall, they are young scientists, students, PhD students, postdocs in from all over the Russia, from top Russian universities, companies, and so on. So thank you again, and goodbye till tomorrow. Bye bye.